so I'll get started here. We'll go through just some of the introduction slides as people filter in. So this is our Digital Scholar webinar for February. We do these every other month, and this is hosted by the Southern California Clinical and Translational Science Institute, or the SCCTSI, here at the University of Southern California and Children's Hospital LA in Los Angeles. My name is Eric Peterson. I am the co-director of digital recruitment and scholarship here within the CTSI, and I'm also an associate professor of psychiatry and behavioral sciences in the Keck School of Medicine here at USC. So today we're hoping can be pretty interactive, so there will be some questions from the presenter that you can put into the chat, but we also ask that you ask questions throughout. And what I'll do is save those questions for the end and present them back to Dr. Perez-Navarro, and we can have a discussion towards the end if that works. So you can do this either in the Q&A part of this Zoom call, or you can do it in the chat. We'll be monitoring both, so it's totally up to you wherever you want to put that in. I think everyone knows how to do that by now. So we're really excited today to be talking with Dr. Antoni Perez-Navarro, and he's going to be talking to us about HIV and STI protection through UBESAFE. Maybe you pronounce that differently, but he has done some really, really cool stuff looking at geofencing and contextualized messaging and gamification to try to prevent HIV and STI. And so what I'll do is I'll put in we read a paper of Dr. Perez-Navarro's and asked him to come join us and present. And he said, yes, luckily for us and for all of you. And so I'll post that picture in the chat, that article in the chat as well, because it is an open access article. And so just to introduce Dr. Perez-Navarro, he is a faculty member of computer sciences in the multimedia and telecommunications areas of the Open University of Catalonia, which is in Barcelona, Spain. He's also a lecturer in the IT department there. He has lots of expertise in physics and science fiction, e-learning, geographic information systems, context-aware recommender systems, and location-based systems. He's talking about some of that today. His research interests are also very broad. They focus on position and navigation in indoor environments, and then the use of smartphones for disease prevention in e-health, which is what the focus of this is going to be on today. And then also video as a supportive tool for teaching physics. So we are really excited to welcome Dr. Perez-Navarro, and I will turn it over to him.
Thank you very much, Dr. Peterson. It was a great honor for me to be today. Tonight for me, it's known for you. So let me share my presentation. And as I said, thank you very much for inviting me to such a wonderful event in such an important institution, because as I told before, we are very much interested also at UOC in translational research. So for me, it's very important to be tonight here. So First of all, in my talk, I would like to say what is my main goal today. My main goal is to show which is the main challenge from our point of view to develop an app for e-health. And it is not a technical challenge, as you will see. So, as we talk, this is what we are going to talk about, the prevention of HIV and other sexually transmitted infections by using geofencing and contextualized messages with a gamified app that is we call it UBESAFE. And as we talked in Dr. Antoni Perez-Navarro, we developed this app with Dr. Felipe A, Besoaín-Pino, that is actually part of his PhD work, and with the collaboration with the people like Dr. Kaila, Dr. Avignon, and Dr. Patricia de Olalla, who are from the Public Health Agency of Barcelona. As you will see, all these elements played an important role in the development of this app. And here is the structure of the presentation. Actually, we're not to start talking about UBESAFE. I will start talking about the technology, because I think that is important at the beginning to know which is the technology we can count on and how can we use that technology. After that, I will show you UBESAFE and not only the app, but all the process we followed to arrive to the app. But I think that is most important, the process, than the app itself at the end, because that has been very helpful later for many other projects. And finally, I will finish with some concluding remarks. So let's start with the technology. And the first part, which are the sensors that we have in a smartphone and a mobile device. First of all, if we have many sensors, actually today it's very normal for us to have all this information, but you have to take into account that all these elements that we can find in any of the smartphones that we have nowadays in our pocket are like a very important laboratory just 20 years ago. We have in a smartphone, we have an accelerometer and pedometer that is for counting the steps, the gyroscope that can help, they say, us how are we moving, proximity sensor that you use it very much. Every time you put your phone in your ear, you are using your proximity sensor, a camera, sensors for the pulse, respiration. Some of the smartphones, some of them have a magnetometer. Most of them nowadays have the GPS. But also, every day more, we have biometric sensors. We find the fingerprint reader, for example. Some of the smartphones have face recognition. We can even find the smartphones with iris reader. Also, the microphone, that is something that was very important during the pandemic, because that allow to detect cough or knowing how you're breathing. We had some smartphones with heart rate meter, although this has moved to the bands and the smartwatches, and many other sensors. We can find smartphones with thermometer, barometer, ambient light sensor, humidity, air humidity. So, as you can see, we have a lot of different sensors. We have a total lab within the smartphone. Just the smartphone, but also we have the connectivity sensors. We are able to detect the telephone network. We have sensors of Bluetooth, Wi-Fi, some of them ultra-wideband. It's absolutely incredible. But then there comes the question, do you know which sensors have your smartphone has? Maybe you can put them in the chat, but and also you can answer the question if you know them, if you know which sensors do you have in your smartphone. Have you think a little bit about them? Not even sure. That is the question, the answer that I was expecting, because many times when you develop something, you don't know exactly which people will count, and people will not know. That can be very frustrating if you're developing something that people cannot install and cannot use. So that is the first thing to know, which are you using. And here in the answer we found in the chat, she said iPhone 11. So this is a very important element to know if your target people will have an iPhone or will have Android, and which kind of iPhone they have, because all these elements, all this information is information that we need to know. But what can we do with those those sensors? We can do things. We can go to the users, or that the users came to us. Usually, how can we arrive to the users? How can we do something? We have something that makes it that acts as a trigger, and as a trigger can act, for example, a position that when you are in a single place, you can receive a message. It's something that you can, for example, is something that the alarm system or iPhone has. To receive a message, when you receive a message from someone that something happens, to being close to a certain mobile, when you're close to another person, to another mobile, something happens, is what happened, for example, in the contact tracing apps that were developed during the COVID pandemic. When you capture a sound, for example, a siren, that something happened. When you detect certain Wi-Fi, then you will know that you are in a single place. So all these elements, and there are many others, can act as a trigger. And something that is important that I would drive your attention during all the talk is that all these elements can operate without external intervention. You have the trigger. When you are in the place, you will see that something happened, for example, and also these elements will happen without data connection. You will not need to have data connection that for these elements to happen. One example is the geofencing. Geofencing is when you arrive to a place, something happened. For example, imagine that when you are near 20 meters of a bakery, you receive a message. The message can be, for example, some kind of marketing. Products are free today, for example. The only thing that you need to have that this thing to happen is that you have the location activated, and of course you need to download it in your mobile phone the information that where the bakeries are. But out of that, if you already have the map in your phone, you don't need any kind of internet connection. You don't need to share information to receive information from a server. You can work totally offline. Basically, when that trigger happens, is that we want users to do something or get something from the users, but actually the trigger is for something to happen. And the things that can happen, for example, is to make the users to do something. We have seen some triggers, and then the users, sometimes the trigger do one thing, but sometimes we want the user to do something. The thing can be a survey. You send an email and you want the user to answer the survey. You can also need that he or she sent us an email, an SMS, that, for example, that she explained her health condition. For example, that when I don't know, but someone is afraid to be afraid of being in a place, that when arrived to that place, that she has to contact her doctor and to explain how she or he feel. But then the difference with the previous trigger is that this time is the user that has to intervene. So we have two important elements. That one is that some things can happen without the user intervention, and sometimes we need that the user intervenes. These two elements can be separated. But be careful, because we have a lot of sensors, can have a lot of information. We can, for example, have the position at every moment. We can track what the user is doing. We can know the temperature of the users. We can record the surroundings. So we have to be very careful with the things that we can do with the smartphone. And every day more people is very aware of those risks, and is something that can generate some kind of rejection to anything that we develop. So, and also the ethical departments can stop a project or stop a development because of not taking these things into account. Of these elements that I speak, do you think that any of them can be dangerous, that any of the triggers, any of the targets? Do you see any kind of danger? For answer, not sure. Is the first answer. We are not sure with are the risks, but the risks are there. And if we are not able to see them, people can see them. Tracking people that don't want to be tracked, that is the main risk. Probably this is a risk that is very clear now, and the ethical department will stop this element, this tracking before developing the project. But sometimes you need to track people. It's what happened in the COVID, during the COVID, that people has to be tracked in such a way. So we had to do that in such a way that we still preserve privacy. But that made the things very, very complicated to preserve privacy. Then finally, after a lot of tests, we discovered that people were tracked. So every time you are collecting a data, you have to be very careful. And sometimes you think that the data you are collecting is not dangerous, but it can be. For example, now we know that getting some very many indirect information from people, we are able to identify people. For example, in the Public Health Agency of Barcelona, they have to be very careful how they recorded the how they informed about the number of people with HIV, because if they inform about the number of people with HIV in, for example, in a street, depending on the street, it was possible to know who the people were. So it's something that just what I wanted to drive the attention to. Be careful with everything you can do, because everything you can do cannot be done. Okay, so after now, at this point, we know that we can do a lot of things with the technology. We have discovered that the technology can give us a lot of activities, a lot of possibilities. And now let's see the app that we developed, UBESAFE. UBESAFE, after knowing of that information, we arrived to UBESAFE. UBESAFE is the third version of the app that we finally published, the third. And we learned a lot from the previous one. And that version, the end version, has nothing to do with the first one. I will make, if we had time, I can explain some of the anecdotes at the end. But it was an app that was developed for preventing HIV. And that conditioned everything. What was the problem that we had in Barcelona at those times? The problem is that some years ago, around 15 years ago, became very popular these kind of applications, Grindr, Manhunt. These applications were to get context among people who have, and among men who have sex with men, and women who have sex with women. Here are two examples, but there are many more. Barcelona was considered among the gay collective one of the European friendly cities for the gay collective. And the Public Health Agency found that when these apps started to be in the smartphones of the people, the number of cases of HIV rised a lot. So, because they found that this kind of apps promote express appointments, and that's reduced the time to rethink or prepare for the appointment. You were there, and then one moment later, you had the appointment. Then they wanted to think how can they promote more healthier appointments. They did a lot of things. They talked with the people who were developing those apps, and of course, they don't want to. The people that developed the apps knew the problem. They can help to solve the problem, but they didn't want to affect the character of the apps, because if you want to have an app that to make contacts, and the app put many problems for you to get a contact, you will stop to use it. So on the other side, you have to preserve privacy of all the users, because it's a very sensitive collective. So they were thinking, what can they do? And then we became to us the idea that was used in the tobacco boxes, in the cigarettes boxes, that they put that message that alerts you about the risk of smoking. It was just the idea that to send a message about the kind of to change some kind of behavior. But we had to be very careful. And the example I put, I like very much to put this example, because it's very easy for understanding the idea. But the example is horrible, because there is a main difference between cigarettes and sex, because cigarettes are bad for your health, and sex is not bad. There is no problem with the kind of life of making sex. It's something that nothing happens. The only problem is that if you don't take the appropriate measures and you have relations with someone who is infected, then you can have problems. But it's important to not criminalize any kind of behavior, especially because they are not risky behaviors. What is risky is not using the appropriate prophylaxis. But that was the idea we wanted to implement. So they think, okay, but then how can we deliver those messages? It is not a box that you can buy. And then the Public Health Agency of Barcelona has a lot of contacts with people with men have sex with men, with MSM. And we made a small survey among them to see where they came from, or for example, where they make contacts. And we saw that all the people uses a very specific places for making contacts. So mainly sauna gays, geolocators, nightclubs, bars. That is the place where people find other people. So that gave us the information that we can send messages related to the location. So we have two informations. People uses an app to get contacts, and on the other hand, people find contacts in a single location. That gives us information of the kind of triggers that we should have to look for, and which kind of messages we have to give, because in the case of the smoking, it was very clear. We have to make people to stop making that, but we cannot do that here. We have to promote the prophylaxis. So then we created a lot of different sentences, and with the users, we looked for the most the kind of sentences they prefer. Here are the translation of the sentences, and you can see that are mainly in positive. Enjoy sex and life. Remember, HIV is invisible. Threats are deceptive, but they are not the negative sentences that we can find in the tobacco boxes. And which kind of sentences they hate, because that gives us also information how they feel. And here, that they are the very negative sentences. The second one, the treatment, it's important to understand that in the logics of Spain. In Spain, the health is public. We have public health, so as a user, it's free. We always receive the most convenient treatment that we need without paying anything. But that means that all the citizens pay for that treatment. So people from the gay collective is very upset with this kind of sentences, because they say, okay, now I need the treatment. Everybody has to pay for my treatment, because I pay for the treatment that people with other diseases need. So, but this kind of sentences give us information on how they feel and what is important for them. So as you can see, we have a problem. We are seeing the kind of elements where we find a possible solution. We see the kind of elements that can help us to deliver the messages, and we are knowing our users. And then we found that we can do all these things with an app. And I wanted to do this road. Probably you were thinking in an app for the very beginning, but we didn't, because an app can be a solution. Another solution could be for example, put papers in the city next to the saunas. But we thought that could be more convenient for the users to make in an app, but we have to be very careful with that app. And that is how came the road when we decided, okay, let's create UBESAFE. This was the requirements of the app. First of all, it has to work in the background, because we don't want to disturb the users. It has to be something that they have to use voluntarily. And then was very important, but then it was an app that it was the target was people who was concerned about the problem. We didn't try to address the problem with people that don't care about HIV, because we will not convince them with an app. So our target was, okay, if it's better to arrive to those people, to people who is concerned, that not to arrive to nobody. Important that we shouldn't criminalize any kind of behavior or choices. Of choices. We just wanted to make them safer. And another thing, we wanted to work only with context information obtained by the mobile itself, totally disconnected for the internet. We don't want to share information with any server, with anything. Then, yeah, as you will see, we share information, but not we, is the user. But the app should have to work perfectly without sharing any information and totally disconnected. Of even giving those requirements to the users, when we ask them, 45% still say that they wouldn't use this kind of app. People actually is very worried about their privacy and about being judged. So, but we had 65% that could use that app. Then here is how they define the app. To promote healthy behaviors to prevent HIV in particular, or any STI, in men who have sex with men. And that is all that we wanted to do, because for women, the app should have to be different. And we created an app for people who already had the HIV, and we were unable to use any part of UBESAFE because the requirements were totally different. And now later, I will show you why they were totally different. And how is the app? Is the app that basically sends preventive messages based on the user's context. Basically, when the triggers are that the user uses an app, when the users go to an URL that he uses for getting contacts, and also when the user approaches to a place where he usually has contacts. These messages are launched automatically. Actually, the app started to launch many messages at the beginning, but at the time goes by, the number of messages decreased to allow users, because if users get accustomed to receiving messages, they don't care about the message. So we don't need to send so many. We insisted very much that all the information is saved just locally, but users can share, if they wish, points of interest, but they cannot share most specific information that can give information about what they usually do, about their preferences, all these kind of things. These elements could help that users to feel safe with the app. And the last thing is that the app was supervised by the Public Health Agency of Barcelona. And this element is key for the success of the app, but was also, as we will see later, the Achilles heel of the app. So how we designed this app? As you have seen, we were talking a lot with the users. Actually, it was created with the collaboration with the Public Health Agency of Barcelona, who knew the topic. UOC, we were the technicians, and also the users of the app. It was a process of co-creation and empathization. And this draw that I put here is because perfectly represents what is the process of co-creation. You have in one side the medical part that want some information and has some needs, and on the other side you have the users. The users had other needs or preferences and want very different things. So it's a process of trade-off, and we have to find the key point in the middle. Let's see how is the app, and later we will go again through the trade-off process. The architecture of the app was that is on a smartphone, as we see, and it can share some information if the user wishes with the Public Health Agency of Barcelona. We will see how. When you install the app, the first thing that it asks to you if you accept to share data, and you can say not. You have to think that this app was developed several years before that the Privacy Act of the European Union has now this is mandatory, but when we created that, it was not. It was only for making users feeling safe. But even if they say yes, that they want to share information, as you will see, they are users, the ones who has to share the information. The app, when you install it, appears in the shape of two apps. One of them is UBESAFE, the total app, the real app, and the other one is the URL patrol, that it was a browser that users can use. This browser had to be created because what we wanted is that the user received a message when he put the name of a specific URL on a specific web page. And but for privacy reasons, the commercial surfers don't allow to have that information. So we created a browser, and the user can say which web pages, with which web pages he wants to receive a message. That allows the user to tune the app to his own preferences, but also allows the app to adapt to future changes at future web pages. If you go to UBESAFE, and UBESAFE is the main app, and you have the main elements. You have the map patrol, that is the geofencing part. You can manage the messages. As you will see, our users are also ruling the messages. The gamification part, with users, as you will see, there is some part of gamification, and also they can contact with the public health agency and also can contact with the developer. So you can find that the app has several elements that go further than the message preventive messages. And also they have the possibility to contact with the public health agency. On the other side, another of the triggers with the apps that should have to launch the message. Once again, is the user who says, okay, launch me a message every time I open this app. Is the user who decides which app to put here and with which apps he wants to receive messages. So nobody needs to know which are his preferences. So let's see the map. The map is the key point of the app. In the map, you can find the locations that will send a message to the user when he arrives to that location, when he's close to that location. But where those locations come from? Those locations, the first ones when you install the app are those that the public health agency has identified, but also the user can add his own locations. And also he can say, in this location, never send me a message. But for example, we show sometimes if some of the users work in one of the saunas, and then they were receiving messages all the day because they were working in the place. So one of the things that he can do is that, okay, here, don't send me a message. But also the user can add his own points, and those points are saved locally, but the user can decide to share that point with the public health agency. He's not thinking that he's sharing that point with the public health agency. He's sharing that point with the community. For example, I found this new sauna. I want that the community knows that sauna, and I share that sauna with the community. Or, for example, I found a friend that I know his location, so I put that location in the map, but I don't share that location because it's my friend and I don't want to share his home. The next thing that he can do are the messages. Okay, we have some messages, but users can prefer other messages. So users can add their own messages. They can put the messages and say, okay, that message is for me because it's a message that works very, very well for me. But they also can say, okay, but I want to share that message with the community because I think that this message is very good. So they put the message, they can share, or they can share not. As you can see, when you install the app, you can put if you want to share data, but every data you share is you have to share it actively. You never share data in a unnoticed way. So when you put the messages are shared, and when you receive a message, one of the things that you can do is to rate that message. What we get with that? what we get is a gamification system in which we have two wins. The first one, we have the messages that were written by the community. So since they are written by the community, probably they will be better accepted by the community. Even they know that those messages have been written by people like them. So they are more, it's easier for them to accept. And also, since they can write messages, you have a ranking. You can see the ranking with your messages and to see how popular is your message among the community. So that helps to use the app, something funny for the app, and users tolerated very well that part. And then, okay, we have shared things with the Public Health Agency of Barcelona. What does the Public Health Agency of Barcelona with that information? You can see here the locations shared by the community. So the Public Health Agency can have all the locations that the users have shared. They can also have the messages. And also the functions that the Public Health Agency do is, first of all, to avoid that people share private locations, other people, because nobody have to know where someone lives. Also avoid offensive messages, because, okay, sometimes people want to be very funny and to put an offensive message. So the Public Health Agency is taking care that everything is okay for everybody. But also, from the other point of view, okay, when someone shares the location of a new sauna, then the Public Health Agency knows about that new sauna. And then they can go there and make a campaign to share condoms, to do a lot of things, because without, and then they know it that just when someone shared that information. So that gives a lot, helps a lot on how to promote the actions in Barcelona. But also, since they have the button, users have the button to contact with them, they can be sure that people will contact them as soon as they have to. And with the messages and with all these locations, they are able to know better all the users. So, do you think that that was enough for the Public Health Agency of Barcelona? You can see they have new information, they have contact with the users. What do you think? You can say yes or no, that there's something that you miss in all these things, or something you would have to add. I am looking at the chat. Is someone write something? Okay. Okay, this is very good question. Keep that question, were they worried about cost? Keep that question for a couple of slices. Actually, the Public Health Agency wanted to send messages to the collective, to contact them, to know how they met, to know a lot of different things. But what happened? They have to avoid to refuse to some of these requirements, just to get the most important thing, that users use the app. Because why do you think that users were so nice sharing so much information? I will ask because I want to go the answer of the colleague. Because for them, if they were not using an app for preventing HIV, users had a finder of points of interest. Actually, when they opened the app, they were directly to the map to find which are the saunas in the near of where I am. So then the Public Health Agency gave up to some requirements to give users something that was valuable to them. And that is what made users to use the app. You have this is the key question. Users, you have to give the users something they need, something they want. They will not be working for you. indefinitely because you are a doctor and you want some information. And they are not, they are healthy people. They have not disease, there's a preventive action. So you have to give something to them and to know very well what is the minimum that you need to get that information. So that is the key point of developing the app, to find what the users need and how can we get something. It's what, for example, Google do. That's what Google does. They give us a lot of things just to get our data. But you receive something and they receive something. And what were the results? First of all, the first result is that the app is working. Actually, one of the things that is important when we develop an app is that include the part of testing, just the technical testing, to know that the app works properly. Because if it has bugs, if it doesn't work, users will not use that. So this is part of the development, and inside the development, you need users that use the app. And then the functional part. As you can see here at some of the results, but what I found most important is that 50% of the messages and hot zones were contributed by users. It was tested for 1 month. And in that month, the public health agency got 9 new hot zones. They only had 7. More than the half they had after that month came from the users. So and actually the messages that they added, more than was the number we had, were very, very well scored by users. So it was a complete success from the point of view of using it. Here you have some of the most popular messages that we find, again, messages that are in positive mainly. And then the question came, why finally was the app stopped being used? And here is where I want to go to the question that we have in the chat. Were they worried about costs? That was the problem. Finally, people stopped using that because the application, one of the main things of the application is that the public health agency endorsed the app. And people felt very good that the public health agency was behind the app and was just reviewing everything, because then they were sure that someone was on the other side. The problem was that the public health agency didn't have enough resources to hire someone to be there and attend the app, to validate the messages, and to do all backup part. That was the different element of the app that made the app not just the typical e-health app unsupervised, that was endorsed app by physicians. So after all this experience, the take-home messages that I wanted to keep is first of all is that although it seems that e-health, that we have a very a complete lab with a lot of sensors, a lot of information. Mobile devices can only help and are one component more in a very complex problem. As I have been talking all the time about the information got by the public health agency, but also the campaigns they were doing in the new saunas that developed, I discovered. We know that we can only address those people that wanted to prevent the HIV and they concern about the problem, but we give up with the people that know that wanted to take risk. So the next element, although we live in a time when now it seems that everything has to be in the cloud, the smartphone is a very powerful computer in itself. So it has a lot of sensors. There is a lot of information that you can get from the environment and a lot of things that you can do without sharing information. And this is very important when you are dealing with very sensitive collectives, and especially with collectives that can be submitted to prejudged, can be judged, that they are worried about what people think about them, and also, they insist, they have no disease. Important to take into account the level of penetration of the smartphones. We also made an app in Kenya. It is a totally different environment, totally different smartphones. And the question if Android or iPhone has no sense, not one, not the other. So be careful. The first thing is to know your target. Number 4 is, for me, 4 and 5 is the 4 is the most important. You have to develop something. We have to develop something that is useful for the users, because if they don't use the app, we will not get anything. It's better to get one thing, that they use it and they get one thing, that getting nothing because we want to get 3 things. So then it's a it's a trade-off between what users need or want and what is the minimum health information that we need. So here you have the bibliography, and thank you very much for being for attending the presentation. And if you have any questions, I will be very happy to answer it. Thank you very much.
Great. Thank you so much, Dr. Perez-Navarro. This was great. I mean, this is one of like a perfect presentation for us. We love, tools that are out there, but we also love hearing about the lessons learned, and kind of some of the things that, you learned along the way, so that people can figure out how to make some of these things for themselves. So we really appreciate that. I'm going to put the paper in the chat for people. And I've got a couple questions, so maybe I can ask a few, and then we'll see if any other questions pop up as I'm going. I mean, it's really interesting, this idea of that people need to get something out of the tools that we're putting out there. I mean, there's things that we want, as researchers, of just general interest, and then also things that, from a public health point of view, society would want. But yeah, I mean, I think you're right. You just have to give something back to the people so that they want to use it. I was really interested in, I just remember like when COVID first started hitting, everybody was doing the COVID tracing. And, I remember when we first got our shots, or if you ever got COVID, they asked you to go in, at least here in the US, they asked you to go in and indicate like, yeah, I have COVID right now. And then they would do the tracking and all that. And I think everybody was really motivated because we were scared and didn't know what was happening. And, I think a motivation for the people in your study too, or just in society, there is just, we don't want HIV to spread. And, we want to help out each other, ourselves, but also just like our fellow people too. And so, yeah, I wonder to the extent that you were seeing that at all with this app or some of the other stuff that you're doing, just like a general want to just help society or help other people.
Yes, the COVID was something very special because every people was concerned with COVID, and it was a pandemic, and people was not ashamed of having COVID.
Mm.
But when we are dealing with HIV, we are okay. Spain, I think, like California, is a country very gay friendly. But for example, if you go to some other countries, they are even forbid. So it's a collective that is always worried about what other people think about them. That is they are very worried about the people. They don't even, people don't like, they don't even like that people know what they usually do. If they are judged. So this element of being trying to avoid HIV spreading is something that they don't is not so like in the COVID. In fact, one of the things that is surprises the most to me is that the people from the Public Health Agency told me that there are some people that when they receive the news that they have HIV, they make, oh, finally, now I don't need to worry much more about being infected because I'm already infected.
Interesting.
because
Yeah.
because they receive the pill and they can live with that. So it's something very very difficult. On the other hand, when the test that actually we studied very much the effect, how well worked the contact tracing apps, and in fact, one of the main tests was performed in Canary Island in Spain, that they have a community in an island and they make a very strong test. And after 15 days, the using dropped completely because people stopped using that. So that for that reason, it's important that users find something that they get that get used to, that is useful for them. For example, we all use Google because it gave us very good search. But if they ask you to, okay, give me your data every day at 5, probably you will do the first week, but not the second. And for us, actually the first the map is the key of the app. And the map was something that we put in a very first version only because we need the map to check if things were working properly. And when users were checking the app, they told us, no, but the app is the most important because for me, that is a finder.
Yeah.
So then we realized that when for them, we were not developing an app for preventing HIV. They used that because they were very useful for them. They used that, they helped the app to find contacts. So, and after that, this is the first one we developed. We learned a lot. We have made several apps for prevention after that. And that has been the key always, to try to find what the user needs for using that.
Yeah, that's so important. That kind of bottom up approach to building these things is great. Actually, I have one more question. We only got a few minutes left, but yeah, I'm wondering if you've talked with some of these other apps, like you showed Tinder up there, or just some other, like, have you talked with them or thought about kind of merging their app with your app? So for example, if they, I don't know, just some of the ideas that you have with yours, especially some around some of those prevention messages. So, after they kind of, find somebody that they're going to go meet up with, showing some kind of message. And I don't know if that actually happens in the apps right now, but some of those established apps that are out there incorporating some of the good ideas that you guys have in your independent app. I wonder if you thought about that at all.
Actually, I don't know, because we thought that when we developed that app, there were nothing similar in the market. We thought in the green, probably you're thinking more in the Manhunt and Grinder, and
Yep. Oh,
we
Grinder.
talked
That's the one. Sorry.
actually, yes. Now I see where you are.
Yeah.
What you are going. Yes, we talked with them about including those messages, but they didn't like, because they said if people see those messages and they don't want to see them, they will stop using the app. So we are doing nothing.
Don't worry about that.
And that is the reason for which we were only targeting people who was concerned about the topic, because if not, there are some there are many people who is not only not concerned, if they are even looking for the HIV. There are some what they call the Russian the Russian game in some flats that people goes there. One of them has the HIV, and the winner is the one that who get infected. So there is many different collectives. So is that is the reason for which, okay, some people can, if I can accept some messages if I have something that to find places.
Yeah.
But they can have to decide, I don't want to receive messages. That is what they can do with the app. Then it
Gotcha.
loses the.
Yep. Okay, that's great. So yeah, I don't see any other right now, but please let us know if anyone wants to get in touch with Dr. Perez-Navarro. We can send you some questions your way if that's okay. And then there's also a questionnaire if people could click on that as well and just give us some feedback. You can also just let us know what you thought about the talk, and then some ideas for future webinars as well. So yeah, just want to take the final moment to thank Dr. Perez-Navarro. This was great. Please check out the paper if you haven't yet, and we will see you all in 2 months.